Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Some hip problems can be fixed with surgery that preserves the hip rather than replacing it. To learn more about this option, I'm talking with Dr. Zachary Vredenburgh. He's an assistant professor of orthopedic surgery at Upstate. Welcome back to the Informed Patient, Dr. Vredenburgh.
Thanks for having me.
Will you first tell us what hip preservation surgery is?
So hip preservation surgery is kind of a blanket term for basically non-replacement surgery of the hip. It can include things like arthroscopy of the hip, labral repairs, and also somewhat bigger procedures like osteotomies, which is where you're cutting bones around the hip to give it a more normal appearance and feel.
But you're not removing big pieces and replacing it with a metal hip or something.
Correct. You're not really using metal and plastic to replace the hip like you would in typically an older patient. Things like cartilage preservation can also be considered under hip preservation, where you're, some cases using stem cells or cartilage transplants and things like that as well.
Why are there more hip preservation surgeries being done in recent years?
I think like a lot of things in orthopedics, there's been new innovations, new techniques, able to be more minimally invasive. I think that's really driven some of this, as well as just more knowledge and more education on this. A lot of this started in Europe, and so I think it's taken some time to get over here. Not that there hasn't been people doing hip preservation type surgery for many, many years in the US too. But I think that's probably one of the things that has led to be a little bit more prevalent recently.
Is it something that all orthopedic surgeons offer?
No. So in the US, we typically kind of divide orthopedic specialties into sports, pediatrics, spine, trauma. So typically the doctors doing hip preservation surgery fall into more of the sports medicine or pediatric doctors, just because of the training that they have. But even amongst that, of sports medicine doctors, there's only a very small percentage that usually deal with hip arthroscopy or hip preservation type procedures. That's because it's a little bit more of a specialized training or specialized thing to do. And same goes with the pediatric surgeons. Some are more focused on pediatric spine, some are more focused on hands. And so it's really the hip specialists that tend to do more of the hip preservation.
So what is the goal then of hip preservation surgery?
The major number one goal is to get a patient's symptoms better. So I tell people this all the time. Many people have labral tears in their hips, and not everyone with a labral tear needs surgery, and certainly not everyone with a labral tear has pain. So it's really about getting their symptoms better under control, and so that they can go back to a more normal, active lifestyle. There's some question with certain procedures, does it help actually preserve the hip? And that's where it's a little bit of a misnomer. There are some hip preservation procedures where there's not great evidence or really no evidence that it actually prevents hip replacement or slows the need for hip replacement. Especially with what I do, it's more about getting patients back doing more functional activities that they want to do.
You said labral tear. What is that?
Yeah, so labral tears in the hip are your labrum is I equate it to a soft tissue gasket around the socket part of the ball and socket joint. And so things like trauma, things like impingement, which is where your bones are slightly misshapen and can rub on the labrum, those can cause tears. You can also, on the other end of things, have dysplasia of the hip, which is where the socket is not quite deep enough, or you have some deformity of the femur bone, the thigh bone, that can cause some tearing of the labrum too. People who are hypermobile can also have labral tears. So there's many reasons to have it and to have symptoms from it.
Is that something that would affect older people or younger people? Who usually would get like a labral tear?
Anyone can get one, and it's more prevalent as you get older, just because degeneration of the labrum causes tearing as well. So the patients that I tend to see are usually younger, but they come in all age ranges. It's often, I think, that the younger people are more functionally active and doing more activities, and that's why they tend to feel it more and probably present more often.
But I didn't hear you say osteoarthritis. This is not for that, right?
Correct. So most everyone who has osteoarthritis has a labral tear, but those people are not really candidates for hip preservation procedure. Uh, you could kind of go into the weeds about what level of arthritis is too much arthritis. Someone with very mild arthritis without really any joint space narrowing is still a candidate for hip preservation. But someone who certainly has bone-on-bone arthritis, or even people with more moderate arthritis, would not be candidates for hip preservation, just because the problem is the arthritis and not so much one little labral tear or the impingement or those other types of things.
Are there other medical conditions that would make someone not a candidate for a hip preservation surgery?
Not really. I can't think of any type of medical problem. Certainly, if someone was extremely ill, this is still an elective type procedure. It's not like heart surgery. It's not like something like that where, you're going to die if you don't have your hip surgery done. So I'd say someone who is very ill medically, but then that's somewhat of a spectrum as well. So I don't think medical issues, certain ones at least, would totally exclude you from having hip preservation surgery.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Upstate orthopedic surgeon Zachary Vredenburgh about hip preservation surgery. What sorts of treatments may be tried first before surgery?
The typical treatments I try and most people would try, one major one is physical therapy. It can really have a profound effect, especially in the hip. That's a very complex joint with a lot of muscles crossing it. So typically I'm trying 2 or 3 months at least of physical therapy to kind of get the hip righted, so to say. Injections are another possible treatment option. They can be helpful both diagnostically, but also therapeutically. They can help you localize, is the problem really in the joint itself, or is it more outside the joint? Can it be the back, which also kind of sometimes overlaps with the hip joint in terms of having pain? There's also some more kind of, when I say injection, I usually talk about steroid injection, but there's PRP, stem cells, things like that there's not quite as much evidence for, but could also potentially be helpful for some people, that some patients will try. And oftentimes activity modification is another big one. So really limiting what you're doing for a couple of months. That can be very difficult for a young active kid who plays sports year round. But I think it's also a critical part of this treatment algorithm, because studies have shown that more often than not, with rest, activity modification, anti-inflammatory medications, plus or minus an injection, you can get especially adolescents back to doing their activities, even if they have impingement and a labral tear, without any type of surgery.
Are people who would be candidates for hip preservation, are they also candidates for hip replacement?
There are probably some people that are kind of on the borderline of whether they need a replacement or not, or whether they could have hip preservation. And I'm kind of been speaking more in terms of hip arthroscopy, because that's, specifically what I do. The other types of a little bit more invasive osteotomies and things like that, typically those patients getting those procedures are a little bit younger, so they're not quite as much on the end of needing a hip replacement. But no, typically it's one or the other. It's not, we think that this arthroscopy is good for you, but also I think a hip replacement would be good. You usually are making your decision between the two.
What are the risks of hip preservation surgery?
So specifically with hip arthroscopy, it's all of the typical surgical risks that you would think about. A big one that I like to mention to people is there is still the risk that you need more surgery in the future. And that includes a hip replacement. It's pretty rare for a young person to need a hip replacement within a couple of years after hip arthroscopy, but it is possible. Some other things, nerve type symptoms after hip arthroscopy is not uncommon, having some nerve type pain going down the leg, although almost in all cases that's a temporary type of thing. And also incomplete relief of pain. Like I said, the hip, there's a lot of pain generators around the hip. So you're really trying to focus in on, is this the impingement? Is this the labral tear causing the symptoms? Is this the dysplasia? Is it something else? But there's always the possibility that if some of the symptoms were coming from the back or coming from some of the muscles around the hip, if it's nerve type pain, that you're going to have incomplete relief of symptoms.
So from the patient's point of view, what is the surgery like and what is the recovery like?
Hip arthroscopy is a same day procedure. You're in and out the same day. It's a couple hour long procedure in terms of all the setup and, the time you're back in the operating room. The procedure itself, you're usually repairing the labrum. Again, this is just through 2 or 3 little incisions typically. And then you're shaving down any of the little impingement that's going on in the hip itself. Afterwards, patients are usually on crutches for a few weeks. Returning to full sporting activity is usually 5 to 6 months minimum, but can be longer than that depending on how the patients are doing functionally. There are a lot of studies out there that show that for higher level athletes playing Division I or professional sports, it takes 8 or 9 months to really get back to doing those type of high level activities fully. So it's not, I think people sometimes hear it and think arthroscopic surgery and I'll be back in 6 weeks. But that's not often the case with something like this. You actually recover from a hip replacement faster than you really recover from a hip arthroscopy. So even though it's a less invasive type thing, the overall recovery is probably a little bit longer. But again, you're doing more activities after hip arthroscopy in the long run than you are after a hip replacement.
Is there physical therapy after surgery?
Yes, that's another part of the recovery. Usually I have patients start within a few days afterwards to kind of try to avoid stiffness and really get walking more normally again. And I try to have them extend it on for as long as possible, but certainly for the first few months, it's a good idea to be actively involved with therapy on a weekly basis.
And what about pain medicine after surgery? Is that typical?
Yeah, usually just for a couple of days. We're having patients use the stronger type of narcotic opioid pain medications, and then it's really just the anti-inflammatories and Tylenol after that point.
And how often is it that someone would go on to need a hip replacement? And are we talking like years later, decades later, or would it be, soon after?
That's a very individualized question. The more arthritis someone has at the time of surgery, the more likely it is that they need one in the near future. The studies are kind of a little bit all over the place on that, but I'd say in an older person having hip arthroscopy, you could be looking at a 10-20% chance or more that they need a hip replacement in the next several years. With the younger patients, that number is almost nothing. When I'm talking 20-year-olds or so, but it's not zero. So there are times where some unique complications like avascular necrosis, which is where the femoral head, the ball part of the ball and socket starts to wear out and die prematurely. That could happen, and that could necessitate a replacement in the near future after a younger person. But again, it's very unlikely. It's just one of the things that's worth mentioning.
How would a patient find a surgeon who offers hip preservation to see if they might be a candidate for that?
I'm not sure if there's one easy website to go to for that. You probably would have to do a little bit of digging into looking at specific practices. Most practices in bigger cities have at least one person who either does arthroscopy or some type of hip preservation. It can be a little bit few and far between, and a little bit kind of doing some digging and looking and seeing what each individual provider does. But usually in most bigger groups, there is one person doing some type of hip preservation, whether it's osteotomies or arthroscopy.
Do you think a person who went to a surgeon who didn't offer this, do you think if they were a really good candidate for this, that surgeon would try to refer them to someone who did offer it?
That's a really good question. I definitely see people from time to time that didn't know that this was an option or a possibility, that had seen someone before. But I think that's becoming less and less frequent. There's, most people know about hip preservation and arthroscopy these days, and even people coming from 2 or 3 hours away to come to Syracuse are aware of that. And I think that's, it's obviously a good thing that it's in the past, maybe that was missed, and now we're kind of seeing those patients.
Well, Dr. Vredenburgh, thank you so much for taking the time to tell us about this. I appreciate it.
Thanks for having me.
My guest has been Dr. Zachary Vredenburgh, an assistant professor of orthopedic surgery at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/inform. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.